Welcome to NGN NCLEX review and case study for anorexia and dehydration. Learn the signs and symptoms, risks, labs, nursing interventions, complications, and more. What is dehydration? Dehydration occurs when there is a lack of fluid in the body from insufficient intake or excessive fluid loss. Medically speaking, dehydration is referred to as fluid volume deficit or hypovolemia. They occur when there is a loss of fluid greater than fluid input. Causes of dehydration: hyperventilation or excessive perspiration without water treatment, prolonged fever. Diabetic ketoacidosis, insufficient water intake as in enteral feeding without water administration, decreased thirst sensation, aphasia, diabetes insipidus. Osmotic diuresis, excessive intake of salt, salt tablets, or hypertonic intravenous fluids. Risk factors: excessive gastrointestinal loss, vomiting, nasogastric suctioning, diarrhea. Excessive skin loss, diaphoresis without sodium and water replacement. Excessive renal system losses, diuretic therapy, kidney disease, adrenal insufficiency. Third spacing, burns. Hemorrhage or plasma loss. Altered intake, anorexia, nausea, impaired swallowing, confusion, nothing by mouth, NPO, causing decreased intake of water and sodium. Expected findings: hypovolemia. Vital signs: hypothermia, tachycardia, in an attempt to maintain a normal blood pressure, thready pulse. Hypotension, orthostatic hypotension, decreased central venous pressure, tachypnea to compensate for lack of fluid volume within the body, hypoxia. Neuromusculoskeletal, dizziness, syncope, confusion, weakness, fatigue. Gastrointestinal, thirst, dry furrowed tongue, nausea, vomiting, anorexia, acute weight loss. Renal, oliguria, decreased production and concentration of urine. Other expected findings: diminished capillary refill, cool clammy skin, diaphoresis, sunken eyeballs, flattened neck veins, poor skin turgor. Ententing, weight loss, low central venous pressure. The effect of fluid imbalance in older adults is greater due to the loss of elasticity of the skin, decrease in glomerular filtration and concentrating ability of the kidneys, loss of muscle mass, muscle tissue holds more body water, and diminished thirst reflex. In dehydration, the client can have an elevated temperature, either a cause or finding. Rapid/severe dehydration can induce seizures. Laboratory tests: with fluid loss due to hemorrhage, hemoconcentration does not occur, hematocrit, HCT increased in hypovolemia. BUN increased greater than 25 mg per deciliter due to hema concentration, urine-specific gravity, greater than 1.030. Blood sodium, greater than 145 milliequivalent per liter with dehydration, blood osmolality, greater than 295 milliosmoles per kilogram with dehydration/hypernatremia. Nursing interventions: provide oral or for rehydration therapy, monitor INO, monitor vital signs as in orthostatic blood pressure and heart rate. Monitor for changes in mentation and confusion, an indication of worsening fluid imbalance. Monitor weight every 8 hours while fluid replacement is in progress. Assess level of gait stability. Encourage the client to use. Call light and ask for assistance because of the increased risk for falls. Encourage the client to change positions, rolling from side to side or standing up slowly. Interprofessional care. Collaborate with other members of the healthcare team, doctor, dietary, respiratory, to determine appropriate fluid volume replacement and oxygen management. Client education. Drink plenty of liquids to promote hydration. Teach causes of dehydration include vomiting, large, draining wounds, and diarrhea or excessive ostomy losses. Complication of untreated fluid volume deficit is hypovolemic shock. Hypovolemic shock occurs with significant loss of body fluid. During hypovolemic shock, the client's mean arterial pressure decreases, which slows blood flow and perfusion to tissues of the body, and the cells are no longer able to carry oxygen to the blood adequately due to the loss of red blood cells. This is a life-threatening event. More of this on the next video. Please subscribe if you like this content. It will make me very happy. Now let's begin. Case study. A 16-year-old female with an eating disorder is seen in the emergency department for fainting episodes. Objectives. 1. Apply knowledge of pathophysiology when measuring vital signs. 2. Compare laboratory values to normal. 3. Manage care of a client with a fluid and electrolyte imbalance. 4. Provide care and education for acute and chronic psychosocial health issues. Module 1 Question 1 of 6. The nurse's notes read, 1100. 16-year-old female brought to the emergency department via car by parents. Client reports syncopal episodes upon standing and appears drowsy. Has a history of anorexia and reports constipation, decreased urine output, amenorrhea, and weakness. Assessment findings include poor skin, turgor and lanugo. Oriented to person, place, time, and situation. Weight. 38 kg, BMI 14.84 kg per square meter. Temperature 96.8 Fahrenheit, pulse 56. Respiratory rate 15. Blood pressure 88/58. Pulse oximeter 95% on room air. Echocardiogram shows no abnormality. ECG, sinus bradycardia. Labs drawn. Which 3 findings require immediate follow-up? Question 1 answer is decreased urine output, poor skin, turgor and blood pressure of 88/58. The rationale is decreased urine output and poor skin, turgor are signs of dehydration and require immediate follow-up. The blood pressure listed is hypotensive and most likely requires intervention. Amenorrhea, lanugo, and constipation are signs of prolonged malnutrition and not life-threatening complications. Module 2 Question 2. The nurse reviews the client's history of anorexia and potential causes of the most presenting issues. For each finding, indicate if the finding is consistent with dehydration, hypoglycemia, or anemia. Each finding may support more than one type of condition. The findings are poor skin, turgor, hypotension, syncope, and decreased urine. Module 2 Question 2 Answer. The findings consistent with dehydration are poor skin, turgor, hypotension, syncope, and decreased urine. The findings consistent with hypoglycemia are hypotension and syncope. On the other hand, the findings consistent with anemia are hypotension, syncope, and decreased urine. Rationale. Dehydration typically results in poor skin, turgor, hypotension, decreased urine output, and can result in syncope. Hypoglycemia can cause hypotension and syncope. Anemia can cause hypotension and decreased urine output. Note that anemia is also seen in clients with renal disease. Module 3 Question 3 of 6. The nurse's notes reads 1100, 16-year-old female brought to the emergency department via car by parents. Client reports syncopal episodes upon standing and appears drowsy. Has a history of anorexia and reports constipation, decreased urine output, amenorrhea, and weakness. Assessment findings include poor skin, turgor and lanugo. Oriented to person, place, time, and situation. Weight 38 kg, BMI 14.84 kg per square meter, temperature 96.8 Fahrenheit, pulse 56, respiratory rate 15, blood pressure 88/58. Pulse oximeter 95% on room air. Echocardiogram shows no abnormality. ECG, sinus bradycardia. Labs drawn. The lab's results return and the nurse obtains orthostatic vital signs as follows. The nurse documents the results. 11:30, lying position. Temperature 96.7 Fahrenheit, pulse 55, respiratory rate 15, blood pressure 110/70. 11:33, sitting position. Temperature 96.8 Fahrenheit. Pulse 56, respiratory rate 16, blood pressure 96/68. 11:36, standing position. Temperature 96.7 Fahrenheit, pulse 86. Respiratory rate 22. Blood pressure 88/60. Question 3. Complete the following sentence by choosing from the list of options to the right. Question 3. The client is most likely experiencing anemia, hypovolemia, or hypoglycemia, as evidenced by the blood glucose, electrolytes, or hemoglobin and hematocrit, and the blood pressure, heart rate, temperature. You may pause the video here. Module 3 Question 3. Answer: the client is most likely experiencing hypovolemia as evidenced by the electrolytes and the blood pressure. Module 4 Question 4 of 6. The nurse begins to plan the client's care. For each potential order, specify whether the order is appropriate or not appropriate to include in the plan of care. The potential orders are as follows: make client NPO. Daily weights at 0-600. Give 1000 ml 0.9% normal saline intravenously at 125 ml per hour times 8 hours. Contact isolation. Begin tube feeding now. Strict I&O. Give 20 milliequivalents potassium chloride PO daily at 0-800. Psychiatric consult. Liquid nutritional supplement. Module 4 Question 4 Answer. The nurse begins to plan the client's care for each potential order that is appropriate to include in the plan of care. The appropriate orders to include are: make client NPO. Daily weights at 0-600. Strict I&O. Give 20 milliequivalent potassium chloride PO daily at 0-800. Psychiatric consult. And liquid nutritional supplement. Rationale: the client needs to begin gradual re-feeding and would not be NPO. The client has no evidence of dysphagia and would not need tube feedings. The client has a low K+ and would benefit from potassium supplementation. The client is hypovolemic and needs fluid replacement. Anorexic clients need strict I&O to ensure adequate intake and that no purging is occurring. The anorexic client will also need a daily weight and psychiatric consult. The client's fear of gaining weight is a sign of unmanaged anorexia. The client shows no signs of infection and would not need contact isolation. Liquid nutritional supplements can assist with caloric intake and prevention of refeeding syndrome. Module 5 Question 5. The nurse's note reads: 1100, 16-year-old female brought to the emergency department via car by parents. Client reports syncopal episodes upon standing and appears drowsy. Has a history of an eating disorder and reports constipation, decreased urine output, amenorrhea, and weakness. Assessment findings include poor skin turgor and lanugo. Oriented to person, place, time, and situation. Weight/BMI, 38 kg. BMI 14.84 kg per square meter. Temperature 96.8 Fahrenheit, pulse 56, respiratory rate 15, blood pressure 88/58. Pulse oximeter 95% on room air. Echocardiogram shows no abnormality. ECG. Sinus bradycardia. Labs drawn. 11:45, provider diagnosed client with hypovolemia and orthostatic hypotension and ordered the client be admitted to the medical surgical unit. Client is tearful and withdrawn, stating, "I am going to gain so much weight here. I worked so hard to be thin." 1300, transferred to medical surgical unit for medical management. For fluid started. The nurse receives orders. Orthostatic versus daily and routine vital signs every 4 hours. Strict I&O. Daily weights at 6 o'clock a.m. Give 1000 ml 0.9% normal saline 4 at 125 ml per hour x 8 hours. Give 20 milliequivalent potassium chloride P.O daily at 0800, first dose now. Question 5. Which tasks can the nurse delegate to the UAP? Select all that apply. Obtain and record daily weights. Take and document routine vital signs. Take and document orthostatic vital signs. Give client potassium 20 milliequivalent PO. Record and document intake and output. Educate client on medical complications of anorexia. Module 5 Question 5 Answer. Which tasks can the nurse delegate to the UAP? The nurse can delegate the task of obtaining and recording daily weights, taking and documenting routine vital signs, taking and documenting orthostatic vital signs, and recording and documenting intake and output. Rationale: the UAP cannot administer medications, draw routine labs or educate the client on medical complications of anorexia. Module 6 Question 6. The nurse's note reads at 17:15. Client has improved with intravenous fluids. Vital signs are stable. Voided 300 ml urine. Psychiatrist with client for assessment. Client to be admitted to a partial hospitalization program in the morning. The nurse has implemented the treatment plan and provided education on the medical complications and the psychosocial components of anorexia. Module 6 Question 6. Answer: the nurse indicates that the following statements. I need to develop non-food related coping skills like journaling to manage my emotions indicates an understanding of the education provided. I am cured and once I am discharged, I will not need to continue with any professional support. Indicates no understanding of the education provided. I grew extra hair on my body because my body did not have enough fat to keep me warm indicates an understanding of the education provided. My fainting spells were caused by my body not having enough fluid indicates an understanding of the education provided. My family and I should talk extensively about what and when I am eating to keep me on track indicates no understanding of the education provided. Rationale: the client needs to develop non-food coping skills. The client should be discharged into a partial hospitalization program for further support as anorexia does not resolve quickly. The severe body image distortion and maladaptive coping skills need to be addressed further after discharge. The lanugo developed from insufficient fat on the client's body. The hypovolemia was caused by dehydration. The client and family should avoid talking only about food as this can support the client's fixation with weight. Bowtie Question. The Bowtie response assesses all 6 cognitive skills during the NCLEX. Recognizing cues, analyzing cues, prioritizing hypotheses, generating solutions, take action, evaluate outcomes. For the Bowtie question. Remember, to answer a Bowtie item, first select the potential condition from the middle well. To make the correct selection, identify relevant data and organize those data to determine what the client's condition is in the clinical scenario. Then review the choices under potential conditions and select the best match for your analysis. After selecting or dragging the client condition into the middle section of the Bowtie, decide on the nursing actions that would be appropriate to manage the client condition and the parameters that a nurse would need to monitor to determine if those actions were effective. Therefore, read the information in the scenario and recognize which findings are relevant, make connections to determine what these relevant findings mean and what condition the client may be experiencing, and identify the client's immediate problem. Then identify possible solutions to address the client's needs, the appropriate actions to take, and parameters to monitor once actions have been taken. The Bowtie question is: complete the diagram by dragging, or selecting, from the choices below one potential condition, 2 actions the nurse would immediately take to address the condition, and 2 parameters the nurse would monitor to assess the client's progress. Possible conditions include dehydration, hypoglycemia, severe anemia, shock. Possible actions to take include potassium supplementation, glucagon, blood transfusion, oxygen 2 liters via nasal cannula, intravenous fluid. Possible parameters to monitor include urine output, point-of-care blood glucose, electrolytes, pulse oximeter, hemoglobin/hematocrits. Bowtie answer and rationale: the client is most likely experiencing dehydration. There is no evidence of severe anemia, hypoglycemia, or shock at this time. The client needs potassium supplementation and intravenous fluids to correct the fluid and electrolyte imbalance. The client does not need a blood transfusion at this time, oxygen levels are stable, and no oxygen is needed. Urine output will need to be monitored to assess improved fluid balance. Blood glucose does not need to be checked as the client has no signs of hypoglycemia. Pulse oximetry is not needed as this is stable. The client needs routine electrolyte monitoring, but there is no need to monitor hemoglobin and hematocrit as this is stable. Case summary: a 16-year-old female with an eating disorder is seen in the emergency department for fainting episodes. The client is found to be severely underweight, dehydrated, and bradycardic and is admitted overnight to treat the dehydration. Thank you for clicking. I will be posting more videos, so if you like to see more, please click to subscribe, like, and share.